با درود و سلام خدمت همه شما بینندگان عزیز تلویزیون جهانی کانال 1. من دکتر نگار متیقنی برنامه طلوع رو خدمتتون تقدیم میکنم. مهمان این جلسه ما یک خانم دکتر دندانپزشک هستند که راجع به بیماریهای سیستمیک و بیماریهای دهان و دندان ارتباطشون با هم توضیح خواهند داد و همچنین ایشون راجع به بیماری کووید در طی پاندمیک و ارتباطش با بیماریهای دهان و دندان نکاتی رو بهش خواهند پرداخت. خانم دکترهایی سلام و خیلی ممنون که دعوت ما رو قبول کردین.
خیلی ممنون، درود بر همگی. با اجازهتون من این برنامه رو به انگلیسی اجرا میکنم چون یه خورده راحت ترم و چند تا خلاصه فارسی هم میگم.
Sure, Hoda Jun, and thank you so much. Dr. Hai, I will go with a brief introduction for our audiences as your bio. So I would take the time to go through your bio. Dr. Hoda Hai is a periodontist who received her doctorate of dental surgery with honors at the State University of New York at Western New York. She then went on to complete an advanced education in general dentistry, residency at prestigious UCLA School of Dentistry, followed by a periodontics specialty at distinguished UCSF School of Dentistry concurrent with her specialty. She also received a master's in oral and craniofacial sciences. Dr. Hai served as the program director of the Advanced Education in General Dentistry residency program at UCLA Venice Dental Center, where she currently continues to teach as clinical faculty. She has received numerous awards, including the California Society of Periodontists Outstanding Graduate Research Award and the Global Oral Health Research Fellowship for her research on antibiotics in periodontics. She is passionate about creating evidence-based guidelines for the dental profession to decrease the overuse of unnecessary antibiotics and help slow the growth of antibiotic-resistant organisms. This is so amazing. Thank you so much for your time and the wonderful information you will provide.
Thank you for the kind introduction. If you like, you can bring us up to slide number 1. As oral systemic connection today, and there are many diseases that are linked to your oral health, but I've only chosen to highlight a couple of the ones that are most famous and most common, and specifically what COVID's role is in that. So just a little outline, we're going to talk about what is gum disease, periodontal disease, its role in diabetes, in stroke, in pregnancy, and lastly, what does it have to do with COVID? So we can start with the first slide, which is a description of what periodontal disease is. And there are many diseases of the mouth, but the one I'd like to focus on for today is gum disease or periodontal disease, which results from a complex interaction between bacteria and our immune inflammatory response. And if you'll see on the next slide, we're kind of going to zoom in on a cross-section of the gum and the gum apparatus. So here you can see a tooth surrounded by the bone, which supports the tooth, and finally the gum that encases over the bone and attaches and adheres to the tooth. Now, what happens in gum disease is there is a dysregulation of this entire system where the plaque and bacteria that's adhering onto the tooth is basically being destroyed or attempted to be destroyed by our immune system. In that process, sometimes the bone is destroyed as well. And that's a very complex interplay because there are patients who have a lot of plaque with minimal disease and others who have minimal plaque and a ton of disease. So on the next slide, I just wanted to briefly discuss what are like those two general groupings. So gingivitis, you may have heard, is really when it's the inflammation and disease only of the gums, and periodontitis is the inflammation and breakdown of the surrounding bone structures, the structures that keep our teeth in place. So if we can go to our first model, which is diabetes. Oh, I'm sorry, I forgot. This is kind of a good example of all the different stages that can occur. So first we see in health, obviously nice pink gums, not bleeding. The bone level is at the level of the crown of the tooth. It then progresses to gingivitis. And finally, with periodontitis, an advanced disease, we might see movement of the teeth, loss of teeth, and a lot more of the roots exposed. So our first and most important model is diabetes. And the reason why I emphasize this so much is this is the only systemic disease that we know of to date where there is a bidirectional relationship. There are some diseases that cause a greater periodontal disease in patients, and there are other diseases that periodontitis affects or worsens in the body. This one goes in both directions. So in type 2 diabetes, there is an impaired immune response and slower wound healing. And because of that, they're more at risk of getting periodontal disease and severe periodontal disease. Now, when patients have severe periodontal disease, thinking back to that model of the plaque, they are, their body is fighting a lot harder to get rid of those pathogens and those bacteria, which increases inflammation and a lot of inflammatory markers. And those inflammatory markers are what signal a greater insulin resistance. What does that mean? Greater insulin resistance is going to decrease your control of your diabetes. So you can see how that cycle is super important. And anywhere that we're able to break that, we're able to help both the diabetes and the control of the gum disease as well. Next slide. So with stroke, specifically the type of stroke that would be affected by gum disease is going to be an ischemic stroke. So there's two kinds of strokes, the non-hemorrhagic or the ischemic and the hemorrhagic. Hemorrhagic would be the types that are caused by some sort of vascular bleed like an aneurysm, but the type that would be affected by gum disease is the ischemic type, which is some sort of thromboembolic event or a cerebrovascular event that causes this. And we've seen with longitudinal studies that patients who had severe periodontitis were 4.5 times more likely to have a stroke compared to patients who had either mild disease or no disease at all. And let's take a look at the mechanism by which that happens. So we have some sort of periodontal infection, and we know that periodontal infection doesn't really fit the standard definition of what an infection is because it's multiple organisms and a biofilm that is very difficult to attack with, let's say, just one antibiotic. And in the process of this infection, we see a lot of gram-negative organisms in the blood, and they release their own toxins, specifically one of those being LPS. And LPS is known to enter into the endothelial cells that are lining the vessels in our bloodstream. So eventually, as there's more and more damage, it causes cytokine formation and production and causes the formation of a thrombus. And eventually, as that vessel wall lining becomes decreased, it increases the chance of an atheroma forming and a thromboembolic event. Similarly, myocardial infarction and myocardial events are also affected by the presence of periodontal disease. The next one is pregnancy and how that affects both the mother and the child. So one of the things that's really important is looking at low birth weight and preterm labor. And we know that low birth weight infants are 40 times more likely to die during their neonatal period compared to a normal birth weight infant. And the reason for that is typically, or at least the highest reason, is preterm labor. We've looked at and studied what causes preterm labor, and there are many causes, but 1/4 of those are caused specifically by infections. So when we looked at those infections and saw how they made changes in pregnancy, we'll see on the next slide, this is how they were affected. Essentially, the process is similar to the cerebrovascular, but now we're looking specifically at the amniotic fluid. That increase of bacteria is going to cause release of bacterial byproducts. These cause an inflammatory response, and specifically the event that they trigger is an amniotic prostaglandin increase of production. That increase triggers the labor process and patients going into labor. So when that happens preterm, now we have increased risk of preterm low birth weight. I also thought this was interesting to show, this is a patient who is a pregnant patient actually, and this is known as a pregnancy tumor or pregnancy granuloma. And we often see these more in patients who are less controlled with their hygiene or don't come in as often or have a lower socioeconomic status. This is highly preventable and avoidable so long as people are getting the care that they need. And lastly, the topic that everyone is most interested in, which is COVID-19, and how is this linked to gum disease? So there are many pathways that have been studied, despite the fact that COVID-19 has not been around that long. But one of the ones specifically that's been determined to play a key role is IL-6. So IL-6 is an inflammatory cytokine. Thinking back, we have the dental plaque and our body is trying to fight that off with an immune response. That's going to recruit macrophages, basophils, neutrophils, all these different types of immune cells. And those immune cells send signals to other immune cells to recruit more help. Specifically, what they're sending out is IL-6. In the next slide, we'll see why IL-6 is so important, because when this is increased, it's normally associated with periodontal disease. And when you develop an infection with COVID-19 at the same time, we know that that also increases cytokine production, specifically IL-6. So this entire dysregulated immune response is what causes a lot of patients who have gum disease, and therefore those who contract COVID-19, to end up with what's called a cytokine storm. And you may have heard this term a lot in the news. A good example to kind of explain this is if you see an animal in your backyard that's small and you wanted to kill it because it's going to eat your bushes or something, you could take a gun and shoot the animal and it would die. But you could also take a machine gun and shoot the animal, and in the process you might ruin some of your lawn, your furniture in your backyard, a lot of your trees and plants, and maybe even kill other animals. This is what a cytokine storm is. Your body is overreacting to the disease that it's trying to fight off, and in the process is killing you off as well. So we see with COVID-19 and periodontal disease, increased risk of having more severe COVID-19 disease when you have periodontal disease, higher risk of requiring a ventilator, and a higher risk for dying. And slightly related to this, what does being on a ventilator mean, and how does that even increase our mortality risk? Well, the reason people are afraid to go on ventilators is because there's a lot of negative outcomes just by being on a ventilator. And one of those is the concurrent bacterial challenge that it comes with. So patients with periodontal disease, they have these normal pathogens in their mouth. Now that they're on a ventilator and they're unable to perform hygiene in the mouth, there are atypical bacteria that are forming also. And the higher risk of aspiration means that patients are more likely to aspirate these odd or atypical bacteria while they're fighting a COVID-19 infection. Now they also may end up fighting a nosocomial pneumonia, and therefore they don't even stand a fighting chance. Now, what can we do? We talked about all these scary things, but actually a lot of it can be prevented. So by decreasing our bacterial levels through mechanical removal of plaque, what does that mean? Brushing, flossing, going in for cleanings, going in for a deep cleaning, and if your dentist or your periodontist recommends having surgical gum therapy, this will reduce your glycemic index if you're type 2 diabetic and give you better diabetic control. Next slide. It will reduce the destruction of your endothelial cell linings and lower your risk of having either a heart attack or a stroke. Next slide. It will decrease in pregnant patients the amniotic prostaglandin production and therefore prevent you from having or decrease your chances of having a premature contraction. And last slide. Most importantly, it's going to decrease that pro-inflammatory cytokine pathway that's known to be associated with more severe COVID-19 symptoms, disease, and complications. یه خلاصه فارسی هم میخوام بگم که تمام این بیماریهای به اصطلاح inflammatory، اونایی که به سیستم ایمنی ربط دارن، هم با کمک و تمیز کردن لثه و استخونای دهن میتونیم خیلی کمک به مریضی های بدن کمک کنیم، مثل کووید 19، مثل زایمان، مریضی قند و سکته مغزی و قلبی.
Impressive talk, so sweet. Thank you so much, Dr. Hai, for your time and the wonderful, sweet talk and information. So it seems that in spite of all the scary things, there is light at the end of the tunnel, and we can proceed some preventive measures. So get rid of the complications, right?
Yes, and I know during the pandemic, it was a difficult time maybe to go in and see your dentist and get the care that you need. But now that things are opening up, it is super important to have your dentist check your gum health, check to see how your bones are doing, if you have inflammation, and help you to make a plan to reduce that.
Nice. I have a question. I go with English and Farsi both. من در گایدلاین های CDC با یک انانسمنتی روبرو شدم که میگه avoid aerosol generating procedures for all patients regardless of known or suspected SARS-CoV infection status. سوال من این هست که پروسیجر های دندون پزشکی که آیروزول جنریتینگه به صورت ویژه با اصطلاحات دندون پزشکی چیایی که باید این موارد رعایت شه؟
That is an excellent question, and a lot of procedures that you will have done are aerosol generating, including having a cleaning or a filling, anything where something is kind of buzzing around in your mouth. But one of the things that dentists have done really, really well is even before COVID-19, we were already trained on standard precautions. So you might even notice your dentist's office now has HEPA air filters. In addition to that, they may have specific air suctions that take out the aerosol and limit that. They may only be allowing certain number of people in the room or certain allotting of time between patients to allow aerosols to settle. And all of these precautions are helping to reduce numbers that are being spread.
Wonderful. پس با کم کردن تعداد بیمارا و تکنیک‌های خاص موقع تمیز کردن دهان و دندان یا پر کردن دندان میشه جلوگیری کرد از انتقال بیماری بیشتر.
Definitely.
خیلی ممنون از وقتت خانم دکتر های عزیز. میدونم که سرتون شلوغه، باید برین مطب و ممنونم بازم که دعوت ما رو قبول کردین. Thank you so much.
خیلی ممنون. خیلی روز خوبی داشته باشین.
همچنین. بینندگان عزیز خیلی ممنون که با ما همراه بودید. ما هر سه شنبه ساعت 6 به وقت غرب آمریکا معادل با 5:30 دقیقه بامداد به وقت ایران تازه ترین اطلاعات پزشکی رو در اختیار شما قرار خواهیم داد. ممنونم. تا برنامه بعدی، روز و روزگار خوش.